in.
Hi, are you Ms. Record?
Yes.
Hi, my name is Brandon. I'm going to be your nursing student today. I'm going to be with you for the next 15 minutes just to do a skin, hair, and nail assessment and grab some vital signs from you. Is now a good time?
Yes.
All right. Can I see your ID band, please? All right. And what is your full name?
Kara Ann Record.
And what is your date of birth?
6/18/2001.
All right. And then do you know where you are right now?
Yes, I'm in my room.
All right. And do you know who's president?
Joe Biden.
All right. So my patient is alert and oriented ×3. Her posture is slumped. Gait was good with a bilateral arm swing. She's dressed appropriately for the weather. The hygiene is clean. Demeanor is calm. Facial expressions are neutral. And speech was clear. All right, so I'm just going to kind of start out by asking about pain. So are you experiencing any pain?
Yes.
All right, can you rate that pain on a scale of 0 to 10, with 0 being no pain to 10 being the worst pain you've ever experienced?
About a 3.
About a 3. All right, I'm very sorry to hear that. Can you point to that pain for me? All right. And then can you describe the pain for me?
It's sharp and, painful.
Sharp and painful. All right. And it's on your knee. All right. And then how long has the pain lasted?
About 3 days.
About 3 days. And then does it come and go, or is it pretty much constant?
It's pretty constant.
All right. And then what makes it better?
I ice it.
You ice it. Do you do about 20 minutes on?
Yeah.
All right. And then do you have a barrier between the ice and the skin?
Yes.
All right. And then what makes it worse?
Being on my feet all day.
Being on your feet all day. Well, yeah, that'll definitely do it. All right. And then does it just stay in that one spot, or does it kind of radiate?
It stays there.
All right. Well, we will definitely let the doctor know. I'm going to go ahead and I'm just going to kind of start with your assessing your hair and your scalp. Is that all right?
Yeah.
All right. So the hair is brown and it is natural. The skin or the hair is kind of a medium thickness, and it is smooth. It appears to be well kept. The scalp, I do not see any lesions, and then the hair is straight. All right, can you stick your arm straight out for me? All right, so the skin color is appropriate for ethnicity. All right, so then the thickness is appropriate for age or condition. It is smooth and then but firm, and then the skin is intact. I did not see any lesions. Can you stick your arm straight out for me again? All right, and then they are warm bilaterally, and I did not see any presence of edema. Can I see one of your hands, please? All right, so the skin is mobile with a rapid release, and then can you stick your hands out for me? So the fingernails are translucent with a pink undertone. Capillary refill is less than 2 seconds. The nails are a kind of a normal thickness, intact, and they appear to be well kept, and then they have a convex shape. All right, and then I'm gonna feel your pulses. Actually, sorry. All right, you can stick your arm straight out for me. Thank you. All right, so then both the radial and brachial pulse are 2+ with a normal rhythm. All right, so then I'm going to move on to your legs. All right, and then those are, the skin tone is appropriate for ethnicity. The legs are smooth but firm. The skin has an appropriate thickness for age and or condition. And then they are warm bilaterally. The skin is intact, but I do see a lesion, so I'm going to measure that lesion. All right, and it is an oval shape, and it appears to be 2 centimeters by 1 centimeter. It is brown, and it is not raised. There's no swelling, exudate, or odor coming from the lesion, and it is flat. All right, and then I'm going to move on down to the feet. All right, and then the nails are a convex shape. Capillary refill is less than 3 seconds. The nails appear to be well kept. It is a convex shape, and then the nails are kind of a normal thickness. They are immobile, and they are attached to the nail bed. All right, and then I'm going to grab your pulses. And then both the dorsalis pedis and the posterior tibial pulses are 2+ and normal. All right, and then can you stick out your arm for me? All right, I'm just going to take a look at your lymph nodes. Can you pull your shirt down for me? All right, so there's no redness, irritation, or drainage in the armpit. The lymph nodes are non-palpable. The lateral, anterior, posterior, and central lymph nodes are non-palpable. All right, and then I'm just going to grab a set of vitals from you. So, do you have a preference on which arm I do blood pressure?
This one's fine.
All right. I'm going to start with your pulse. All right, so then the pulse is 52, 2+ and normal, and then the respirations were 16, unlabored, and a normal depth. All right, and then I'm going to grab that blood pressure from you. So can you stick out your right arm for me? And can you hold that for me? Thank you. Alright, so then your blood pressure was 128/78, and your right arm in a sitting position. Alright, and then is there anything else I can do for you before I leave?
Nope.
Alright, well thanks for letting me work with you.
Thank you.